Hi, my name's Lauren. I've had Lyme disease since I was 16 years old. I've been treated many years. I started treatment in my 40s. I didn't know what I had when I was in my 20s and young teens. I was diagnosed with ulcerative colitis and suffered with that. I was on prednisone for years, about 8 years. And then I got diagnosed with Lyme when I was in my 40s after having my 2 children. At that point, I went to ILADS doctors and was treated with high doses of antibiotics for I probably did that for about 6 years and then continued to relapse and not feel good. So I just started searching out alternative methods to get treated, and I had done a couple different Cowden protocol and some of these other herbal protocols, and then I came upon the Lyme Laser of New England, and I just wanted to give it a try because I was relapsing again, wasn't feeling good, and as a nurse I needed to have my brain thinking clearly and not have the brain fog, and I also wanted to get rid of my joint pain. So I came here. I've been treated I just finished my treatment and I'm starting maintenance, and I would say that my brain fog is completely gone. My joint pain is 95% better, and I have a little bit of stomach issues still, but overall I feel excellent and just enjoying activities of daily life now that I couldn't before. So I'm just happy I found this place, and I'm excited to live and go out and start hiking again and doing all the things I used to do.
Good for you. Lauren, can I ask you a couple questions?
Sure.
Were there any fringe benefits that you got out of the treatment that you weren't expecting?
Yeah, the close camaraderie of being around people that had Lyme, and also being able to talk to you one-on-one all the time, each visit I came, and just the overall politeness and welcomeness that came with coming here each time. Everybody was very nice and welcoming, and everything was explained to me. The videotapes were great to watch to see what the treatments were for and how they were used to treat Lyme. So that was very helpful.
The protocol is 12 weeks.
Yeah.
When did you start to feel better? When did it kick in? I think I found something that's going to work finally.
Definitely by the 30 a month. I definitely felt a lot different. I felt a little bit different within 2 weeks, and then by a month I was feeling a lot better, and my energy was coming back because the fatigue was a big part of my problem also. And so, and then by the 3rd month, by the end of it, I was, when you were asking me how much better, I always felt like I was 90 to 95% better, definitely.
Perfect. Your daughter has Lyme. I believe she's going to start the protocol very soon.
Yep.
Huh?
Yep. I wanted to be the guinea pig before I sent her here.
And one more question. You are a nurse. You mentioned you were a nurse earlier. You've been in that field your whole life, right?
Yes.
You also mentioned to me that you worked for something, an organization in the Lyme world for quite a few years. Can you explain to me what you did and what that was all about?
Sure. I worked, it was a grant fund through Massachusetts, state of Massachusetts, to work as a Lyme disease educator in this area. And so my job was to go out and educate nurses, doctors, the community, schools on Lyme disease and prevention, and not really treatment, but prevention of it. And through that job, I met many people in Boston doctors and became close with them and got diagnosed during that time. But I still, after going through all the treatments and the antibiotics, I still felt like I was relapsing, and I just felt like there was something, there was another level I wanted to get to as far as improving my health, and I felt like I've done it through here. But yes, I did do Lyme disease education probably for about 3 years.
Okay, cool. Well, I said that was the last question. I have one more.
Okay.
A lot of people are going to be watching this film. Every one of them, like you, are very skeptical. They're saying, okay, somebody finally figured out the solution for Lyme disease. What would you tell these people in an elevator speech about what's happened here? What would you tell them Period. What would you tell them?
I would say that I was very skeptical about this at first too. And then when I came, and being a nurse, I was assessing everybody as I was going from room to room. And I kept on asking the question, how do you feel? How long have you been doing this? And they said, I feel great. I feel so much better. I feel 90%, 95% better. So I just kept on thinking in the back of my mind, that's where I want to be. And I continue to do it. And exactly what happened to them happened to me. I just felt so much better by the end.